Hello and welcome to In Time TV's On the Edge. I actually am going to be talking this hour about cardiology and innovations in cardiology, especially imaging innovations and some special procedures. Joining me this hour, two guests, actually one guest from San Antonio, Texas, and one from Hawaii. And from San Antonio, Dr. Janet Hayes. Janet Hayes is, that's FACC, she's a cardiologist, an associate professor of medicine and director of nuclear cardiology and co-director of UT Heart Station at the University of Texas Health Science Center in San Antonio. Also joining me is Dr. Joan Flanders, FACC. She is the medical director of the Hawaii Heart and Brain Center. She's also the chief of cardiology at North Hawaii Community Hospital. I did want to give a little background on Dr. Hayes and Dr. Flanders. Dr. Hayes received her internal medicine and cardiology training at Brooke Army Medical Center. She is a former officer in the military. After working in both military medicine and private practice and gaining additional skills in interventional and nuclear cardiology, she came to the University of Texas Health Science Center in 1998. At that center, she focuses on clinical teaching and the care of patients with cardiac disease. She has, she staffs the cardiology catheterization lab, the echo lab, and the CCU, and is heavily involved in UT Medicine outpatient heart station, where she is the co-director. She has a special focus on nuclear cardiology and directs the nuclear training for fellows. She's board certified in internal medicine, cardiology, echocardiography, and nuclear cardiology. She has also received training in coronary CTA. Her research interests lie in the clinical care and management of patients. Dr. Hayes is also active in the community and has served at all levels in the San Antonio Cardiovascular Society. She has received several awards from the American Heart Association, both at the local and state level, and teaching recognition for cardiology fellows. Dr. Hayes has also participated in several volunteer medical missions overseas. And welcome to the program, Janet. I appreciate your joining us, coming all the way from San Antonio. I should mention that both of you are joining us care of the ACC, the American College of Cardiology. Meetings are in Chicago at McCormick Place this weekend, and you were kind enough to give your time from those meetings. Joan, I would ask that you give a little bit more background about you as well. Sure. First, where did you get your medical training?
I went to medical school in Iowa at the Osteopathic College there in Des Moines, Iowa.
All right.
And then I actually did my training at the University of Texas Health Science Center in San Antonio.
In cardiology?
In cardiology.
Now, your certifications are in cardiology?
Cardiology, internal medicine. I'm also a fellow of the American College of Cardiology. That's what the FACC stands for. And a fellow of the American Heart Association.
All right. Any other special background that you'd like to mention?
I do the imaging as well. I'm nuclear licensed and also have had certification in cardiac CTA.
Okay. Very well. Well, welcome both to the program. Thank you so much for joining me. We are talking this hour about procedures in cardiology. I would like to start by just defining some terms, some things that I know that I wonder about from time to time. I have done programs in the past where I've talked about interventional radiology. I've talked to some folks who do certain invasive and non-invasive procedures in internal medicine, and the conversation has come around that there's a graying of lines between the different specializations in internal medicine. Certainly this has to be true in cardiology as well. Some of the procedures that other specialties do are also kind of encroaching on the territory, the turf of the cardiologist. Can you, Janet, differentiate between invasive and non-invasive cardiology?
Yeah, non-invasive really refers to a lot of imaging, be it by echocardiography or CAT scan or nuclear. As opposed to, or MRI, as opposed to invasive, which is something done in the cath lab, or basically having to put in a special catheter into a blood vessel and get to the heart and do things with it there, giving X-ray dye. So it's a bit more risky, any type of invasive procedure. And really both specialties are exploding, and they cross over too. Some things that you could only get by invasive methods before, now you can get by non-invasive methods.
Okay. Joan, I know that there have to be a different set of certifications for invasive versus non-invasive. Are these different fellowships as well, or how does that work? Once you've trained, if you're going through a typical cardiology residency, would you then go on to specialize in a fellowship?
Yes, actually there are the so-called super subspecialties. For example, some of them are formal and then some of them are informal. For example, long ago there was a subspecialty of medicine called cardiology. First you just hung a shingle and called yourself a cardiologist, and that just meant you basically studied harder in that one area and excluded the other parts of the medicine to concentrate on that area. Then that became a fellowship trained and a mandatory fellowship trained specialty. Even within cardiology there are now fellowship defined subspecialties. Invasive would be the interventional cardiologist, and they actually do have to do I think it's now a 2-year fellowship.
Well, there's invasive, and then there's an invasive non-interventional, and then there's invasive interventional.
And interventional. Fraying of the lines.
Okay, so invasive cardiology is procedures in the cath lab. Interventional cardiology is angioplasty. Okay.
Whereas invasive
like
could be just the diagnostic.
For example? Okay.
Yes.
Now, what about radioablations? Would that be an invasive
that's
procedure?
electrophysiology.
Yeah.
Okay.
That's
once
one
again
of the
a
super
subfield.
subspecialties.
Yes.
Super subspecialties in cardiology.
Exactly. Where you actually go through another year or two of training in what they call electrophysiology, and then you are invasive still, but confined to electrical invasion or in electrical procedures of the heart.
And I want to get back to some of these procedures. I want to pick up on that a little bit later in the program. Under invasive, but since you are here, care of the American College meetings, maybe we should talk a little bit about ACC. And I don't know how heavily involved either or both of you are, but someone want to pick up the ball and tell us a little bit more about the American College of Cardiology.
Well, this is the largest cardiology meeting in the world.
All right.
And I don't know the actual numbers, but we're guessing somewhere between 20 and 50,000 attendees here.
Significant, yeah.
So a large international component that comes here, and there are so many things going on at once. There must be 100 sessions going on, as well as the exhibition floor and satellite meetings and researchers meetings. To me, it ought to be a much longer meeting to get it all in.
Okay. We're going to go to a commercial break. Stay with us. You are watching End Time TV's On the Edge. Conversations in, well, let's say cardiology. I'm Dr. Jonas Moses. With me, Dr. Janet Hayes and Dr. Joan Flanders.